Good afternoon, everyone. It is Tuesday, April 7th, and we're preparing for our Tuesday update. So I'm going to just give us a few seconds and wait for a few people to come in. While we are waiting for people to come into the live, I'm going to ask that you please share this video. Start sharing it now. If you could please start a watch party now. We are preparing to start in just a few seconds. But I'm going to ask that I'm doing it on my own. I'm going to share it on my personal page. We're just waiting for a few more people to come in. I'm sharing it. Okay. So hi everyone, this is Mayor Shawn Patterson Howard, and as I said earlier, it is Tuesday, April 7th, and I promised you on Sundays with Shawn that we would be doing Tuesday and Thursday updates, and so we're about to start. Please, before we really get started, I'm asking that you start a watch party or share this. We want to make sure that as many people as possible can get this information. So if you would just take out a moment and do what I just did, and I started a watch party on my page, if you could do the same thing, start a watch party on your page. All right? Okay. So Mount Vernon, we received our updated numbers, and as I've always told you, each time I've come to you live or I've sent you something in writing, that our updated numbers sometimes jump high because they're filling in the backlog on the county and the state system into our system. And so as of yesterday, we had 583 confirmed cases. And as of today, we have 717 confirmed cases of COVID here in Mount Vernon. So that does not mean that 100 and some odd people became positive between yesterday and today. What it really means is that the backlog is catching up and we are getting the information on the positive cases. So I want to put this into context as to where Mount Vernon stands in the county numbers. Currently in Westchester County, there are 14,916 confirmed cases of COVID in the county, but of those county numbers, only 7,211 of them do we have confirmed addresses for. So Mount Vernon is 10% of the confirmed address cases. Out of 7,211 cases of confirmed addresses for COVID, Mount Vernon has 717. But if we look at the 770 other cases in the 7,705 other cases in Westchester where we do not have addresses for, if we go with that same 10%, we could assume that Mount Vernon probably has another 770 cases. So there are 14,916 confirmed cases in Westchester. Of that, 7,211 of them we have addresses for, and 717 of those addresses are in Mount Vernon, which is 10% of the confirmed addresses and cases of COVID. And if we look at the other 7,705 confirmed cases that we have, that we currently do not have addresses for, and we use that same 10%, we could assume that Mount Vernon has another 770 cases that we do not have addresses for. Of the 717 cases that we have addresses for here in Mount Vernon, there are 499 different locations. And I say that because people keep asking, do we have big clusters of cases in Mount Vernon that we can track? Do we know where the hot spots are? As we've already said, we have clusters of cases in the Wartburg, and we have clusters of cases in the Westchester Rehabilitation Center. Other than that, we don't have any real cluster of cases. We are starting to see increasing cases though, up to 5 or maybe 6 cases in some apartment buildings in Mount Vernon. So when you live in an apartment building and someone in your building is positive, you're using common areas like the elevator and maybe trash compactor rooms. And so we encourage you, when you are leaving your apartment, in your apartment building, you still want to make sure that you're wearing your mask, that you're wearing your gloves, that when you're using the elevator, that you're using your gloves to push the buttons, or that is after you finish pushing the buttons that you're using hand sanitizer, or that you're washing your hands. These are common areas in apartment buildings. Where you go to collect your mail in that area, those are common areas. And so we are seeing, 5, 6 cases in some apartment buildings in Mount Vernon, and it's probably about 20 apartment buildings all throughout the city, north side, south side, east side, west side. And these are larger apartment buildings, so we're not shocked. But we're telling you, even when you live in apartment buildings, you still have to make sure that when you're using common areas outside of your apartment that you are sanitizing, that you use precautions. So some positive news from the governor's daily briefing is that he points out in the past couple of days that there have been a number of people discharged from the hospital, that the number of people being discharged and able to go home and who are recovering for COVID has become greater than the number of people that they're accepting into the hospital. So that is some good news. We are seeing more people go home than we're seeing on a daily basis be admitted to the hospital. But I'd like to remind everyone, especially, like I said again, those of you who live in apartment buildings, to still remember to practice social distancing as much as possible. If the elevator is going to be crowded, wait for the next elevator. If there's a lot of people in the area where you're picking up your mail in your apartment building, wait. As you're using your laundry rooms in the apartment buildings, if the laundry room is full, this is not the time to sit there and try and get your laundry done. And after you finish doing your laundry, take your laundry upstairs and fold your laundry in your apartment to limit your time in the common areas in your apartment buildings. I call on all of you, everyone in our community, to thank our police, our fire, our EMS, our DPW, our water department, all of our healthcare providers who, whether they're doctors, nurses, home health aides, anyone who's working in the healthcare industry, for their work on the front lines. We also have to remember those who are working in our essential businesses like supermarkets and pharmacies and CVS's and things of that nature, who are there that allow us to go in and still have some normal semblance of life so that we can go and do our shopping. I want to thank all of them for continuing to go out there and be on the front lines of this as we continue to push our way through COVID. I'm going to switch gears for just a second and I'll get back to COVID. We're in the beginning. I need you to remember to fill out your census. It is so critical that we participate in the census right now. As of April 4th, Mount Vernon still has the lowest numbers of census responses, of self-reported census in the county, but we have gone in a week's period from 16% to 30.8% census responses. So Mount Vernon, thank you for starting to share the news, but I ask that you continue to share the news. You can go to mycensus2020.gov, mycensus2020.gov, and complete your online application. You want to make sure that everyone who lives in your house is represented on the application. It's really, really critical that we ensure that everyone is being counted in our community. If you don't have access to the internet, you can do this via phone at 1-844-330-2020, 1-844-330-2020. 2020, and they have people working on the phones from 7 a.m. to 2 a.m. That's 19 hours a day. That's more than enough time for you to get your census in. And it's going to take you less than 10 minutes. And what does this mean for Mount Vernon? Mount Vernon, we believe that we were undercounted back in 2010 by about 30,000 people. And that comes to about $80,000 to $83,000 a year in potential funds that we're missing out on. And we only do the census every 10 years. And so if we don't get this right, Mount Vernon can lose out on anywhere from $800 to $830 million worth of community services over the next 10 years. When you say community services, what do I mean? I mean road repair, bridges, sewer repair, hospitals, schools, firehouses, fire equipment, police departments, after school programs, nutrition programs, Medicaid, Medicare, senior services, youth services, family services, for people coming home from incarceration, reentry programs. The census impacts every part of our lives. Every year, over $800 billion. $800 billion comes down from the federal government to state, county, and local communities, but it's all based on our census numbers. And so if we are not fully counted, then we automatically lose money and we miss out on opportunities to apply for money and then get money that communities receive based on formula funding. Formula funding means simply this: the number of people times this equals how much money we get. So if we miscount by 30,000 people, then we're going to get less money automatically. So we have to make sure that we are counted. So what do we want you to do? We need you to call your friends, call your family, call seniors, go visit your seniors. Well, you can't visit them right now, so you could do a three-way call with some seniors you know who may not have internet, and call that 1-844-330-2020 and help them walk through and complete that census application. If you're in a fraternity, a sorority, a church, a neighborhood association, PTAs, send out email blasts. If you're on a sports team, whatever type of group that you belong to, send out an email blast to all of your members and your participants. Make phone calls to your members and your participants, because even money for parks and playgrounds. So, you know, with our sports and things of that nature, that money comes also based on our census numbers. When we're able to apply for grants, for public funding, for private funding, they always want to know about our demographics, meaning the number of people we have in our community, the ethnicity, the age, the income, things of that nature. So census information is critical. So we're going to go now back to talking about and giving COVID updates. So if you don't catch everything the first time you go through this video, I really encourage you every time that I do a video that you pull out pen and paper or rewatch it, because we're going to be giving out very valuable information that you can use for unemployment, for small businesses, for mental health services, and anything that you might need. I'm just going to go back for a second and see if we have questions. So the one thing that I want to say, and they said it on here, which I did skip, the census does not count your legal status. So they don't care if you are a citizen, if you're a resident alien, if you're undocumented, they don't care. We just have to make sure that we're counting every single person that lives in this community. We want to make sure that we get the funding that we need to provide these critical services. So here we go with some of the COVID-19 updates. You can visit the city's website at cmv.ny.com/COVID, COVID-19. And we have a portal there that will take you to a lot of updates that I'm about to provide you with. So City Hall continues to remain closed to the public. City Hall remains closed to the public, just meaning that you cannot come into the building. But you can still call all of our City Hall departments. We have forwarded our phones to our home and to our cell phones so that we could respond to your questions. We are still getting back to people. When you send in emails, we're still responding to those emails. And so we want to make sure that you understand that the city is fully operating through phone and email right now. Alternate side of the street parking continues to be suspended. Alternate street side of the street parking continues to be suspended. By next week, we will get you a quarterly calendar, a calendar that shows you when we need you to move your car. We will need people in each quadrant of the city to move their car at least one time per week. We need you to move your car at least one time per week, so that we can come through with the street sweepers and take care of the neighborhoods. So we want to make sure that we're sweeping our streets in every neighborhood at least one time a week, and we will get you that schedule. We'll put it up on the city's website by next week, and we'll share it also on our social media platforms, and we'll try and get it out to you in your neighborhoods, utilizing some of our police and fire and other essential workers to help us deliver that information. To pay your taxes, if you are trying to pay your taxes, you can pay them online at cmvny.com/pay-a-fee. So you can go to cmvny.com/pay-a-fee to pay your taxes online. If you do not want to pay your taxes online, then you can mail in your taxes to the comptroller's attention at 1 Roosevelt Square, and the comptroller's office should process them, but they are also accepting payments via mail. Please continue to use the city's website as well as our social media platforms to get updates on our state of emergency while we are operating this way. So we've had a lot of calls from small businesses. We know that entrepreneurship and small businesses are the backbone of any society. And so for small businesses who need assistance, there's a county hotline that you can call at 914-995-2900. Just contact 914-995-2900 for small businesses. And you can also find out more information on small business support at this website. This is the New York State website, and it is esd.ny.gov, esd.ny.gov, and that stands for that's the Economic Support and Development Department for the state of New York. You can also seek more information from 211 on small business supports. The city of Mount Vernon and the school district continues to provide free grab and go lunches at 5 different locations. Last week, the school district increased their grab and go locations. So it is Benjamin Turner, it is Grimes, it is Graham, Parker, and Trapphagen. So the grab and go lunches are available from 9 a.m. to 10:30. So they give you, when you come between 9 and 10:30, they give you breakfast and lunch at Graham, Grimes, Parker, Benjamin Turner School, and Trapphagen. So we have the north side, the Heights, the south side. We have all quadrants of our city are included in the grab and go lunches. I know YCOP was also giving out at Mount Vernon United Methodist Church, and I don't believe they're doing it this week, but we will let you know if they start again on Monday. We continue to deliver over 1,000 bags of food to seniors and families here in Mount Vernon. If you need nutrition support, you can reach out to our Department of Recreation at 914-665-2420. We will be having a grab and go giveaway tomorrow again at the Dole Center. Yesterday we gave out over 30,000 pounds of fresh produce as well as non-perishable items, and we will have another grab and go tomorrow at the Dole Center between 3 and 5 p.m. Some other updates and helpful information. On Friday, Senator Biaggi, Senator Bailey, and myself sent a letter to the New York State Governor regarding both Montefiore Hospital and also requesting that we get our own testing site here in the city of Mount Vernon. You know, we understand that with Mount Vernon having 717 confirmed cases and then the potential 770 other cases that we believe would probably be Mount Vernon's, but they do not have addresses for in the county, so we can't officially put them on our list, that we really need our own individual testing site. We are still working and pressuring and pushing to get a testing site here, and we will keep you updated. But as of right now, you can continue to go to New Rochelle's testing site. It's the state's testing site at Glen Island. But anyone who needs to be tested, if you are symptomatic, if you have a fever, and if you have other symptoms, multiple symptoms of COVID, you can go to Mount Vernon emergency room, Mount Vernon Hospital emergency room, and any of the major hospital emergency rooms like New Rochelle, St. John's, Dobbs Ferry, Sleepy Hollow, White Plains. You can go to any of the major hospital centers here in Westchester. If you are symptomatic and you've contacted your doctor, go to the emergency rooms to be tested. They will determine if you meet the threshold for testing. But if you are feeling sick and you're having multiple symptoms, reach out to your primary care provider. I've spoken to a lot of people who have had, who've been tested by their, or been sent to hospitals by their primary care provider, or their primary care provider has done some type of web assessment, you know, online assessment, face-to-face assessment through FaceTime or something with them. And, you know, they've prescribed whatever they needed and had them stay home and take care of themselves and only have to go to an emergency room if their symptoms progressed. So still reach out to your primary care physician. You can do some web testing. There are several urgent care centers that are also providing testing, but always, as we've always recommended from the beginning, please call first before going to get tested, and they will walk you through that process. Governor Cuomo has now expanded the stay-at-home order and the no-school order. He's moved it from April 15th to April 29th. And so we are still expected to stay at home to work and do distance work, as well as online schooling right now through April 29th. I expect that to be extended, but for right now, April 29th. The state is increasing the maximum fine for social distancing. So we've been saying that the only way that the curve is going to get better is that if we stay at home and when we are out in public, that we use social distancing. So we're not supposed to congregate in numbers greater than 10, and they're even asking us to do that less now. And so, you know, here in Mount Vernon and other communities, as we see people continuing to congregate, we will give a warning, but we will start also issuing fines. And those fines have gone from $500 to $1,000. Some people will applaud this decision, and then there's others who will criticize it and say that the government is doing too much and we're imposing martial law. But let me be very clear about this. When I go on Facebook, when I go on Instagram, all I am seeing, and it is overwhelming and it is breaking the spirit and the backs of so many people, is RIP, rest in peace, rest in peace, rest in peace. We are losing our neighbors, our friends, our classmates, our parents, our grandparents. We're losing our children. They are dying. Let me be very clear. Behind our hospital is 2 refrigerator trucks. And these refrigerator trucks are not for food or anything else. They are for bodies. They are for people who are dying, and our morgues and our funeral homes are filling up, and we have no place to put them anymore. And so we're putting them in refrigerated trucks behind every hospital in the county. And if you don't understand that we are beyond kind of just asking you to stay home, we are explaining to you that we're dealing with fatality management throughout this county because there is nowhere to put the number of bodies that are stacking up. And if that doesn't help you to understand that we're dealing with something that you and I have never seen before, I don't know what it will take. And so no, we are running out of patience and we are running out of time. We are saying, stay home, stay home, stay home. If you don't want to have to stay home throughout the summer, then we need you to stay home now. We understand that it's nice outside. We understand that the apartments and the houses can become small and frustrating. But what is also frustrating is picking up the phone every day and every night and hearing of our friends, our neighbors, our relatives who are dying from COVID, whose lives are being snatched from them because we don't know how to stay home and because we don't know how to social distance. Please, it doesn't take rocket science to help you understand that if you go out, you need to go out only for essential business, and you need to go out and have a mask and have gloves. All the masks are reusable. So when you come home, take off your mask, spray it with Lysol, put it in the corner, and go out the next day and use it again, or whenever you have to go out. I have to come out only for work, but everyone else in my house has been home for weeks, and the only time they come out is to go to the supermarket or to the pharmacy. So stay home and save lives.
Price gouging. Price gouging in town.
So I'm seeing that there's a question about price gouging at Food Town. We are having our code enforcement officers as well as our essential business task force and our consumer protection staff go and check places and businesses that we are getting price gouging reports at. There are some places that are actually price gouging, and unfortunately, there are some places where we go and we ask them, how did they set this new price? And they show us our invoices, and they show that the amount that they're being charged, because there is so little supply and so great demand, you know that's the law of supply and demand. And so right now, even when we're trying to purchase N95 masks, there are places who are saying they're $3 a piece, and there's other people who are saying they're $7 a piece. And so price gouging is happening, but some price gouging is based on what those stores are being charged by their vendors. So when you go into a store, there are some stores that are even putting up how much they're paying and how much they're charging you, so that they can show that they're not intentionally price gouging. But in order to get some of these supplies into the store so that they can get it to you, there are prices on key items that are being raised. But we continue to check to make sure that the amounts that they are charging are not way above and beyond what they are paying. So please continue. You can call 914-665-2626 and give us specific information about the stores and the product that they are price gouging with, and we will continue to investigate it. And as we find people who are price gouging, we are writing fines, and if we are finding legitimately that they had to increase their prices based on what they paid for it, then that's what we're doing. If you feel someone is unfairly price gouging, you also have the right not to purchase that item, because the stores are telling us that they are not taking refunds, or they're not giving refunds, and they're not allowing people to give products back to the stores, because once the product leaves the store, in order to take it back, they're going to have to wipe it down and sanitize it and make sure that it hasn't been exposed to COVID. So they're saying right now that they're not giving refunds until after May 4th. So if you buy it, it's yours. If you feel they're price gouging, make a complaint and then go back and, we'll get back to you on the complaint, and then you could always go back and purchase it if you still want it. The governor and myself, we've been talking about the uptick in domestic violence, and we know we did on our Sundays with Sean. So if you haven't watched it, go back and look at our Sundays with Sean episode. We talked about social distancing, the stay-at-home order, people becoming frustrated because they don't have money, because they have to stay inside, because they're overwhelmed, because they're unsure about their future, because friends and family members are dying or ill, that we are seeing an uptick in domestic violence. please know that you're not alone and that there is help out there. There is help out there, and so you can always reach out, and I want to give you a number. If you're experiencing domestic violence, you can always call the police department, but you can also call the state hotline at 1-800-942-6906. People who have experienced domestic violence traditionally, we're seeing an increase in that, and others who may not have been experiencing domestic violence or child abuse, we're seeing some more of it because we are living a very different life that is very stressful and uncertain for the future. You're not alone. Please reach out, get help. We don't want to see any fatalities happening. We don't want to see people be hurt, and we don't want to see our community being hopeless. So please reach out to help for not only the hotline, but also to family and friends. And to family and friends, I really encourage you during this time where we're not able to visit each other, if you have FaceTime, if you have Facebook Messenger, go on there, and when you call friends and family, every once in a while, call them on FaceTime so that you could see their faces, not just hear their voices, but see their faces so that you could see if something is looking different. Are they not getting out of the bed? Are they not dressing and washing? Are they becoming depressed? Sometimes we can fake it in our voices, but when you see someone, and if you don't see the light in their eyes, then you know something is going on. On Sundays with Sean, we had our Miss Marlene Furtick, who was a licensed clinical social worker and the site director for the Mount Vernon Division of Family Services of Westchester, and she talked about just having those mental health checkups. And not just hearing what people are saying, but really listening to what people are saying and are not saying. We're not asking you to be anyone's therapist, but we're asking, even when you converse with each other, to go beyond the superficial of, hey girl, how you doing? What's going? What is your day looking like? To really just checking in and doing a check-in and saying, how are you doing? How are you handling this? How is your family? How are you doing mentally and emotionally? This is what we have to do right now for people that we care for. It's not being nosy, it's being family, it's being friends, and it's building on those authentic relationships. So if you are a New Yorker without health insurance, you can apply through the New York State Health Department through May 15th. But you must apply within 60 days of losing your coverage. And so if you've been laid off or let go, or you don't have health insurance, you can go to the New York State Department of Health website and apply for health insurance through May 15th within 60 days of losing your coverage. Consumers and small businesses experiencing financial hardships, you can defer paying your health insurance premiums through June 1st. So if you are a consumer or a small business and you're having difficulty paying your health insurance premiums, then you can defer your payments up through June 1st, 2020 to make sure that you continue to keep your insurance. Disaster loan assistance. Disaster loan assistance is now available because New York State has been declared as a disaster site. So all businesses and nonprofits in the state of New York are now eligible to apply for federal low-interest disaster relief loans if you've suffered significant income loss due to COVID-19. So if you're a business or a not-for-profit in the state of New York, you can go and apply for disaster loan relief, and I'm going to give you the website. The website is disasterloan.sba, Small Business Association, sba.gov/ELA. So you can go to disasterloan.sba.gov/ELA if you are a business or a not-for-profit in the state of New York and you have lost income and you've experienced significant losses due to COVID-19, please go and apply for disaster relief assistance. Governor Cuomo also announced the launch of the New York State COVID Tracker. So if you want to track COVID cases across the state of New York, then you can go to www.ny.gov/COVID COVID-19 tracker. That's again www.ny.gov/COVID-19 tracker. And this will provide New York State's comprehensive coronavirus testing data to the public. It'll be updated daily with the latest data, and it'll show you statewide and county level data. So you can access this. You can also get it through Open New York at data.ny.gov. So if people who are really interested in tracking corona cases across the state and see where our county sits, you can do that. The governor also announced that all across the state, we are still looking for more PPE supplies. That's personal protective equipment. That's masks, that's gloves, that's shields, that's goggles, gowns, Tyvek machines. And if you, Tyvek uniforms, if you're able to help locate personal protective equipment, please call 212-803-3100 or visit COVID-19 supplies at esdnewyork.com. Westchester County has created an email address to respond to inquiries regarding the coronavirus. So if you're a Westchester resident, Mount Vernon, anywhere in Westchester, you can send an email to COVID-19FAQ@westchester.gov. COVID-19FAQ@westchester.gov is an email that you can send some of the COVID questions that you might have to Westchester County. You should expect an expert response within 24 hours of your message. These emails are monitored and answered by the Westchester County Department of Social Services. So within 24 hours, you can expect a response from our Westchester County Department of Social Services and the subject matter experts that they have working with them. And New Yorkers can call COVID-19 emotional support line at 1-844-863-9314 for mental health counseling. That is, again, if you are having some emotional and mental support needs and you need to reach out, then you can call 1-844-863-9314 for mental health counseling. We've gone over an incredible amount of information today. And as always, I like to just go a little bit back to the beginning where we started. And I'll just say again, Mount Vernon's number today of confirmed cases is 717. We have 717 confirmed cases of coronavirus here in Mount Vernon. Not coronavirus, just talking too much. 717 confirmed cases of coronavirus here in Mount Vernon. But as I stated also, there is another 7,705 cases in Westchester County that addresses have not been attached to. There are 7,705 additional cases of coronavirus in the county that addresses are not, attached to. And so Mount Vernon right now has 10% of the known confirmed coronavirus cases with addresses, 10% of that. And if we attribute the same 10% to the confirmed cases of coronavirus in the county without addresses, then we could even say that we have another 770 cases. People continuously ask about the numbers. The numbers are important, but I've always said they're not important. I say for every case of confirmed coronavirus that we have here in the city, we should multiply that by 3 to 5, because there are people who may never become very symptomatic that can still be COVID positive, 19 COVID positive, and still transmit this. So please, whether you're living in a house, whether you're living in an apartment building, when you are in public areas, in apartment buildings, like I said, elevators, laundry rooms, where you pick up your mail in your building. Make sure that you are wearing a mask, that you are wearing gloves, and when you're getting your mail, when you're doing your laundry, when you're in and out of the elevators, that you're sanitizing that area and you're protecting yourself, because we are seeing an uptick in some of our apartment buildings throughout the city. And so if someone in your apartment building is COVID positive and they're asymptomatic and don't know it, and they're coughing and they're using the elevators or the laundry room and things of that nature, they can transmit this virus. So it's very, very important, if you're living in an apartment building, that when you're in those public areas of those apartment buildings, that you are protecting yourself and using, personal protective equipment. And as soon as you get into your apartment, that you're sanitizing your hands, you're cleaning your face, and you're taking care of yourself, as to not track this virus back into your home. So Mount Vernon, I just want to say thank you so much. Alternate side of the street parking is still in effect. Alternate side of the street parking is still in effect. Alternate side of the street parking suspension is still in effect. Parking meters being suspended is still in effect, so you don't have to worry about parking here in Mount Vernon. But next week we will be sending out an update, because we will need each neighborhood to move your cars at least once a week so that we can get back to some street cleaning. We are in the Holy Week season for Christians, and then tomorrow also starts Passover. So I want to wish a continued Holy Week to our Christian faith and our Christian community. It is very difficult for many of us that we're not able to celebrate and worship and fellowship in the way that we traditionally do, but because of our need to reduce the curve and flatten out the curve, we will not be having our services and our traditional services at our churches and at our and Passover services at our synagogues. So please, do things online, call each other, encourage one another. God is still God, even in the season of COVID. So please enjoy your Holy Week. Passover begins tomorrow. The Passover season begins tomorrow. So please, for my brothers and sisters of Jewish faith tradition, please enjoy your Passover. Friday is Good Friday. I know that the United Black Clergy of Westchester will still be having a 7 Last Words of Jesus Christ service. So look for that information. I believe they're going to be doing a Zoom and doing something online live. A lot of our churches and synagogues and temples are continuing to do things live and online. So look for those services, because while we may not be able to gather, we can participate in the innovative ways of Zoom and Facebook Live and streaming services. We will be rebroadcasting this update tonight at 9 p.m. We will be rebroadcasting this at 9 p.m. and we'll come back to you on Thursday at 3 p.m. with a new live update that will be broadcast again Thursday at 9 p.m. And then also remember, Sundays with Sean, we will be doing that on Sunday evening at 8 p.m. For those who know people that do not have social media, they can also get these updates through www.cmvny.com, which is the city's website. They are usually put on the city's website within a few hours, so they can go to the city's website. And if people don't have internet at all and they need to see these updates, we will be showing them within a few hours on channel 18 and channel 30. Channel 18 and channel 30, which is the public access station. We cannot go and knock door to door to everyone's house. We just do not have that capacity. And so we're asking that you partner with us in sharing these videos and sharing these updates so that people can see them. We will be doing a robocall, if not today or tomorrow, to also give people who don't have access and give them a very, very brief update on where they can go to get more information. The robocalls are never more than a minute, so it's not going to be a lot of information, but we will let them know that updates are being given on social media, on our website, and as well as our public access station. So thank you so much, Mount Vernon. Thank you, Westchester. And for our communities all across the country that may not have reached where we have with coronavirus. Please look around the country at what this is doing. Take this very seriously and begin to prepare in advance and change your behaviors so that your communities are not hit as hard as we have been hit here in New York. Please see what people are going through and pay attention to the media. And everyone, I also encourage you to watch the Governor Cuomo's updates every day at 11 a.m. He does updates on all of our major news channels, and that helps you to stay plugged in. But also, very importantly, we need you to take care of yourselves and step back every once in a while. Step back from TV, step back from social media, and unplug, because we are dealing with an overwhelming amount of bad news every day. And I know, as I look at my friends on social media and as I talk to my friends on the phone, and as we scroll through our timelines, we are seeing rest in peace, like we've never seen it before. And sometimes we just have to step away from the bad news, find a way to take a moment and have personal solace, pray, reconnect with our friends, reconnect with our families, and reconnect with our faith foundation so that we don't get sucked into depression. We all have to take care of ourselves, and we all have to find ways to take care of each other. Mount Vernon, we will get through this together. We will come out stronger. We will come out better, and we will come out with new, renewed hope and faith in the future. This will change our lives as 9/11 has changed our lives. Every generation has some type of incident that changes their lives. We've gone through 9/11, and in a few months, prayerfully, we will be through COVID, and we will have learned new lessons, and our lives will be changed forever, but we will see better days ahead. Encourage yourself with that. Continue to lift each other up, and everyone be blessed. I appreciate you all, and I'll see you again on Thursday. Take care.